The breast implant surgery or breast augmentation is one of the commonest aesthetic surgery or cosmetic surgery that is done in the world, and for which silicone implants are used. There are basically two types of silicone implants. One is called as silicone gel filled and the other one is a saline filled. The initial silicone implants were made up of silicone outer covering and they were filled with thick silicone gel. These were the earliest silicone implants, and they had some problems about leakage of that silicone coming out of the shell, and that is why there were problems associated with that silicone gel coming out. And so the industry, the silicone implant manufacturing industry sort of went on to improve these silicone implants. The later generation were made up of thinner silicone shell, and the gel that also was filled in was thinner, and as compared to the first generation there was no seam line, so it was seamless structure, and these had a better shelf life, but still again there was a problem of silicone leaking out, which is called a silicone bleed. It was the molecules were diffusing out of the silicone shell, and again there were problems associated with the silicone gel coming out, and hence the third generation silicone implants were made, which consisted of two types of covering shells which were separated by another layer, and these were also a little thicker, and so this was done in an attempt to prevent the silicone gel coming out, and these were better tolerated. But the problem associated with the silicone implants continued, although in a lower ratio, and so the improvements were made, and the fourth generation silicone implant that was made was to make the surface of the silicone shell textured instead of being smooth as it was earlier, and this was all to reduce the problems associated with silicone implants, which I will refer to you later on. And the latest improvement that has been done is to change the viscosity of silicone gel that is inside. Previously it was a gel form or a semi-liquid. Now it has become very cohesive, so it doesn't flow out. It is stuck together, so that even if there is by any problem there is a rupture of shell, the gel doesn't flow out. So this is the latest or the fifth generation of silicone implant that has been made. As against these all silicone gel filled or cohesive gel filled implants, there were silicone saline filled implants also, which were introduced in mid-60s in France. These had some advantages because you could sort of do the breast augmentation through a very tiny incision, or even endoscopically, where you could hide the scar either in the axilla or even in the umbilicus, and put the implant in the chest area, and then inflate these implants by saline. So that was one advantage, and also the disadvantages of silicone gel leaking out was also obviated. Although these were the advantages of saline filled implants, there were few problems because of which they were not very popular. One of the biggest problem was that these implants deflated. So in the early 60s, the percentage of deflation was almost 75%. So the manufacturers did some improvements to reduce this leak. The second disadvantage was that the wall that is allows the saline to go into the implant but not come out also could fail. So that again had led to problem of leakage or not being able to fill the implant properly. And third disadvantage was that some of these implants didn't have perfect smooth surface, so they gave an appearance of wrinkling of the implants, which in a thin person was very obvious. Coming to the risk associated with silicone implants, some of the people think that they are risky because in 1992 the FDA in USA banned the use of silicone implants. This was more to do with litigation that happened over silicone implants, which were being associated either with cancer or with the arthritis some patient had. So after detailed investigation, it was found that most of these associations were by chance and not as a cause and effect relation. And so in 2005, the FDA did introduce use of silicone implants again, and now those are being used rather freely in USA. These were never banned totally in Europe while they were banned in USA. So there are no risks associated with silicone implants as regards the problem of arthritis or cancer, breast cancer, as some of them used to think about. The complications that can happen with silicone implants are like with any other implant that are put in the body, that sometimes there can be a small percentage where the implant can get infected. The chances of implant getting infected are less than 0.1%, so that's very negligible. And the second complication that can occur, which is called as capsule formation, which is where the body forms a thick tissue around the implant, and this thick tissue can contract and cause hardening of the breast. All these improvements that have been done to reduce the leakage of silicone gel and also production of textured implants have been able to reduce this incidence of capsular formation.